I got my medical degree 20 years ago, and back then we only had paper records. No computer, no internet. Since then, doctors' way of working has changed dramatically. And we've been talking already a lot about here, how can we make doctors more efficient? And we give them tons of data. Tons of data, we give them computers, we give them analytics, we give them genes, biotechnology, all this to make them more efficient. But what about the patients? What about making the patients more efficient? Think about the banks. They've been really, really good at outsourcing all the work to us and at the same time making us more happy. Why can't we do the same thing in the healthcare system? A very big problem in healthcare right now is the lack of knowledge and communication. Patients don't know what they need to do. They don't know their treatment plan. They don't know what they need to do at home to monitor their conditions. They don't know when they need to call the doctor. And if you think about it, the doctor has got all these computers now, all this technology, and they're looking at it and they're seeing the patients, but it still is up to the face-to-face time that the doctor has to educate the patient, to motivate them, to change lifestyle, to tell them the treatment plans, and to send them home. So we expect patients to go home, know all about their treatments, be happy, change their lifestyle without giving them anything. So we've been working very hard on doing exactly that. We've built a patient-centric platform where we pull out data from multiple back-end systems, EMR systems, medications, labs. We pull it out in and center it around the patient together with the patient's own observations. Integrated devices, mobile apps, their own manual input about what they observe and about their health at home. Within our platform, the patients have access to all their information online. They have a health score where they can assess their lifestyle, find out what they're doing good, what they can do better. They have a health record with all the things that they might think is boring, but it's so important if they get sick. The allergies, diagnosis, medications. They can monitor their chronic conditions through their health status, and they can have a to-do list and a treatment plan so they know what they have to do at home. We work very hard on giving a visual tool to the patient so they better understand the numbers. We integrated to more than 60 different devices and mobile apps so that they can monitor their health at home. Then we show it on a graph so that they can see if they're in the red area or in the yellow area, and we let the doctor work with them and set individual goals together with the patient. So if the patient has a blood pressure that is 145 now, the doctor can say, let's go down to 130, and get them down to 130, and then we go down to 120 after that. So it's about giving tools that the doctor can work together with the patient in individual goal settings. We develop chronic care tools. We talked earlier about if a patient gets diabetes, there's a lot of things they need to know about the condition. The doctor will ask, so do you have any problems with your eyes? Any problems with your feet? Any cramps in your legs when you're walking? You go tick, tick, tick. And the patient walks out and says, I don't know why the doctor asked me that. I have no idea. There's no time in the face-to-face time that the doctor has to actually educate the patient about what they need to know about their health. So we build tools where we translate that knowledge into a system so the patient can go at home and go and tick, tick. And if there's something that goes red, they can read more about what's important and what's not important and when they need to contact the doctor. We work with mobile apps to make it available for them, notifications, easy to report. Take a picture of something that you want to put in your notes section. You can do it on the app and it will go directly into your own personal notes that you then can show your doctor the next time you go there. And we have a health card that makes it very easy to share data, because it's not worth a lot if you have only one doctor to one patient health platform. It's worth something for the doctor right there, but if you really want to do something, you've got to make something that gives value to the patient. And it only gives value to the patient if he owns his data and he can take it with him around to all the doctors he's seeing. So in the doctor end, we work very much on building a platform that makes it easy for them to analyze, plan, monitor, and communicate. We are not an EMR system. We are not trying to be that. We integrate with the EMR systems, but what we do is we try to replace faxes and phones and all those systems that today we have to use for communication with the patient and build it into a system where the patient can then see it. You can set up treatment plans so that you can show the patient exactly what they need to do at home. When do they need to go for checkups, and what do they need to do for their own monitoring at home. When do they need to step on the scale, measure your blood pressure, etc. And all data will go onto the app, notify them, and they can input it and will go back into the system. We have follow-up lists that shows doctors and nurses when values are out of range. So if you have a patient that you want to monitor more closely, you can put them on a follow-up list, give them a blood pressure device, go home, connect it, and they will monitor their blood pressure at home, and you don't have to call them and find out what's going on. It will go up on the list here and show exactly if somebody's out of range, and then you can look into their data and find out if you need to help them more. They have a patient dashboard, which gives an overview of the current status. And if it's needed, you can reach out to the patients through secure messaging, text, or video call. Secure View is used a little different depending on what healthcare system we're in. So we're right now in Europe, in Scandinavia, in US, and in South America. In Denmark, we have 30% of the population using Quretu. It's a public-funded healthcare system with a fee-for-service payment structure. The goal there is to optimize processes and make communication easier. So the government there, they are giving a fee to all the doctors to reply messages online, and they, at the same time make it mandatory for all doctors to give these tools to their patients. So today we have a system where all Danes can go online, book appointments, ask for prescription refills, send messages to their doctors. No matter where they are in the country, if they're in their summer house, whatever they do, they can go online and communicate with their doctor. We have then also built in systems so that they can have a family member help them. If there's a child that needs help, the mom can do it from one login. You have an old dad that needs help getting the prescription refilled, or there's a question about what's going on, then the daughter can go online and talk directly to the doctor. Test results are sent directly to patients online, and they can then, if they have any questions, send a message securely back to the doctor and ask whatever questions. So eliminating face-to-face time and making communication more efficient. And then they use mobile devices to monitor their health and share it with the doctor. In the US, it's a little bit different. We work a lot with accountable care organizations and networks that are taking care of Medicare patients. So it's population payment plans with quality measures. What's happening there is that we have a lot of networks coming together, of small practices, forming a network, and all of a sudden they together have to take care of a population. But they have different EMR systems, they have no way of data sharing, and they have the problem that the patient can go to whatever doctor they want to go to. So that means that they have a lot of duplicate tests. Patients are going to different doctors, the doctors don't know what's going on, they don't know the treatment plan, they take another lab or another x-ray or whatever, so the cost is going up. What we do there is that we put the platform in the middle there, we pull out records from all the EMR systems, combine it with claims data, combine it with labs, and all of a sudden, when the patient is going around, every single doctor can see the treatment plan, and every single doctor can see the latest data that's on the patient. Another problem they have is that they have to live up to these quality measures, so they have to have them in for the screenings and all that, and they don't know what patients have done what. They don't have the systems to do that. So with our treatment plans, now they know which patient is falling behind, and if they need to call them in, they can do it automatically through the system. So are patients willing to use a solution like Quretu? Well, they are. We, as I said, have clients in 3 different continents. We have more than 1.8 million users on the platform, and 22% of those are 60 years or older. We work very hard on making the platform available for the elder generation. We have more than 500,000 communications messages, secure messages sent every month through the platform. And a practice with Quretu has an average of 65% of their population online after a year using Quretu. In the US, they have a Medicare, the meaningful use requirements where they need to get to 5%, and they are struggling to doing that. One of the problems is that they have a very simple model where they show something to the patient, but there's no value in it for the patient. They just show, here are your latest results, but the patient can't do anything. So they have the patients go on once, and then they say, I'm not coming back. There's nothing in it for me. So you have to think about what's in it for the patient. So what have we learned? We've had a lot of challenges in these 15 years. First of all, payment models, as mentioned. If you have a fee-for-service structure, you have to have a fee for doing online interactions. Otherwise, they won't use it. And in our experience, the population payment plans are the ones that really are working the best. The EMR, HIS systems, definitely a challenge. They are built for fee-for-service treatment. They're not built for integrated care. They have no interface for patient interaction. And they are often very reluctant to share data with anyone. But luckily, many regulators now forcing the EMR systems to open up, give the patients their data. Once they give the access to the patients, we can take that into our system and build our platform around that. And then the organization's internal workforce. I've heard a lot about talking about doctors don't want to do this. We haven't had that problem. Doctors see value in this because they all of a sudden can much faster help a patient understand their health. But where we do get a problem often is the technical departments, because technical departments generally in the healthcare sector are made for building solutions for the doctors. So they don't have any experience in patient consumers, and it's a completely different world, really different. So either they overestimate it and say this is never going to happen, nobody will use it, or they underestimate it and they say, well, that can't be that difficult, I'm just going to do this. I'll do that in the weekends, I'm going to build something for our patients. Usually they fail. Front desk people we've had challenges with, afraid of losing their jobs because today a lot of them are doing all this communication with the patients, but what we found out is once they do adapt it, they are the ones that like it the most, because all of a sudden now they can have the boring things done by the patients themselves, and they have time to help the patients that really need some more hands-on. So how to succeed implementing a patient engagement platform? In our experience, first you have to build a solution that works for both doctors and patients. If you build a solution that's only for patients, you forget the doctors or the other way around, nobody will use it. We've had a lot of success building a system that can be tailored to the existing work processes. So don't try to change what's already going on in your organization. Because if you have a platform that is flexible, you can tailor it to each department, and each department will then be able to kind of work with it in a way that they feel comfortable with. And then we brand our solution. So you won't see Cure for You all over. You will see Hospital XX or Dr. ZY. And the reason why we do this is that now we give ownership to the people that are actually using it, and at the same time we enhance the trust of the patients. Make it easy to get started. Integrate key functionality as much as possible. Automate processes. And roll out step by step. Either take one department and say, well, we're going to get one pilot department now where we're going to implement everything. Or you say, like, we are only going to implement the secure messaging or the shared treatment plans. Because you have to get the workforce using it step by step so they feel more in control and ready to open up and use it. One thing you will see if you try to roll it out too fast is that you will have the front desk people and the doctors saying to the patients, well, it's not working. Yeah, I know. The hospital says that we should use this, but it's not working. Let's just continue. So you have to get the people that are using the software on board with this because it's so brand new. And then focus on the patient experience. Let the patients own this. Make them add, make them edit. If you only have a patient view thing, they'll go in and they say, oh, they're curious, seeing, oh, that's exciting, I can do something. And they come in and they see they can do nothing. So they walk away and they're not coming back. And you've lost them because it's so much harder getting them on the next time. So rather wait and have a good platform for them than start out with something that is not working. And set up a dedicated support team to help patients with technical problems. Because all of a sudden now you're working with consumers and you're working with the elder generation. So you're working with, they have Internet Explorer version 4.2, or they have their browser set up to, because they can't see, so they have the browser set up to like a scale like this, so they can only see like this little part of the whole screen. Or they can't find out, I mean, one of the things we have is that we have two-factor security login to enhance security. So you log in and then you get a PIN code sent to your phone or to your email. And that PIN code, it runs out after 24 minutes. So we said, oh, that's going to be easy, not a problem. So we implemented it. What happened was that all of a sudden we had all these old people calling us because they'd go online and they go in and say, oh, I have a PIN code sent. Fine, but they are not in a hurry. So they go out, they make a cup of coffee, and they have lunch, and then they go back, and then the PIN code is not working. So there's a lot of those things that you have to help that patient consumer population with now, and you really don't want that to be done by your doctors and your nurses. So either have somebody do it, like we have in our company. When we roll out, we take that technical support in-house and help our clients with that, or you have a technical dedicated line within your hospital where patients can call or can chat with and can get help. That was it.